Hi, good morning, everybody. Thank you for being here. I'm just going to pull these off now that I know they're working. It's great to be here today. If you're interested in how AccuWeather, a weather company, a weather data company, is working with the Children's Hospital to advance pediatric healthcare, I think you've come to the right place. I'm Jonathan Tan. I'm a pediatric anesthesiologist. I'm also a public health professional and a spatial data scientist. And usually when I give these talks, someone always points out one of them doesn't belong. But here I am today, and it's great to be here. I love my job because it's an opportunity for us to take care of children of all ages as they get surgery. We not only put kids to sleep and control their pain, but we also take care of them in the entire perioperative process. We manage kids' hearts, their lungs, their brains, and make sure that they're safe throughout surgery. Another part of my job is also to make sure that we're able to advance pediatric healthcare by understanding and doing research on our entire population of children at our hospital. And then as a spatial data scientist, working with different spatial models and geographies, different data to help advance the care we provide. At Children's Hospital Los Angeles, our mission is to create hope and build healthier futures. We're the largest children's hospital on the West Coast of the United States. We see about 24,000 kids for surgery and anesthetics. And really, it's a wonderful place to work. We care for an incredibly diverse population of children. At some parts of the day, you might care for the child of a tech entrepreneur. And just a few hours later, it'd be very easy for us to care for one of our children that's actually undocumented. We're the only children's hospital in the United States that's a safety net hospital where we care for all children. Our kids travel from all over the United States, in fact, all over the world, if I were to zoom out from this map. And it's a really wonderful privilege and demonstrates the expertise that our hospital provides. And when we think about our children that we care for, every single one that walks through our doors, many of them are very diverse by age, by disease. They have cancers, they have respiratory diseases like asthma, and other things like that. And some of our kids are as young as 5 minutes old. They get brought right over, and we go right into the operating room with a brand new baby that probably should have stayed in mom for a few more weeks. So that landscape being set, I want to take you down to Los Angeles, just a quick 1-hour hop by plane. I think when I moved there a few years ago, I realized that LA is all of this. And then when I really started living there, I realized that Los Angeles was much more like this. And when I think about traffic and driving around, we think about air pollution, air quality. When we think about air quality, we think about all of our kids have asthma in our hospital and the challenges that they bring to their own health, the challenges that their families experience, as well as our hospital in terms of caring for them in the emergency department, in the operating room, in the ICU. We also think about actually extreme heat. We think about the environment around our children and our patients across our city. This is actually a cover article of National Geographic that was conducted by some studies from the University of Southern California, where they looked at the number of trees and how much heat was related to tree coverage. And so actually in some of our parts of our city, our kids are exposed to 20 trees to every one person. And just in the same city, same zip code, there are some places with 20 people to one tree. And the heat differential in our city can be up to 8 or 9 degrees Fahrenheit difference just in the same moment in time across our city. This is a huge disparity issue. It's a huge healthcare issue. And of course, there are wildfires that we all have to deal with across the country at this point. So I bring up all of this to say that these are something that we know about for many decades now as the social determinants of health, where there are social factors, economic factors, language, economic factors, and environmental factors like air quality and air quality exposure that influence the care that influence the health that we experience. In fact, 80% of the health that we experience as individuals is known to be the result of social, economic, and environmental influences. And all the groups, major organizations below really agree to this. So if I were to ask right now, if you go to your doctor tonight or tomorrow or next week for your next appointment, given how important these social, economic, and environmental factors are, does your doctor have access to this information to care for you? Does your doctor have access to air quality information for you? Even though we know that air quality is so influential in our breathing health and in asthma. So I took a look at this a few years ago, and the answer, as you probably recognize, is 0. None of that information exists in your patient records, no matter how digital we are in healthcare today, right? None of that information exists at the point of care. None of the information even exists for research, to be able to do large-scale research studies across an entire hospital or across an entire country to look at the impact of air quality. And so we started building this just a few years ago, and we're excited to be here today to share this. So we've been building a whole digital platform for social and environmental determinants of health and bringing that to the bedside and all of our scientists in our hospital for them to leverage. And it starts by taking your individual patient record in a private way and ensuring there's privacy and trust in this process. We add that into local area data, geographic data. And of course, we partner now with AccuWeather, who's a climate solutions accelerator, whose data and expertise is allowing us to provide solutions and understand how to better care for our children. And I think together we're able to really advance the work we're doing, and I wanted to provide some examples of that today. So if I were to this one basic question, what is the air quality exposure of our pediatric patients at home? We know that at this point in science, air quality is basically causal for development of asthma, for exacerbation of asthma, for how often you might use the emergency department for asthmatics. Air quality is measured in many different ways, and smaller particles penetrate deeper into the body. So you look at a piece of human hair on the left of the screen there, PM 2.5 is particulate matter 2.5. So those are all the things that are in the air that we can't see that are 2.5 microns and less in size, incredibly small. And if you look on the image on the right, PM 2.5 or microns that small actually penetrate deep into the lower lungs. And this is actually why these smaller particles initiate asthma, cause asthma, and make it worse for our kids. There's even particles that are smaller, PM1 and PM 0.1, and there's a lot of ongoing emerging science around studying those factors as well. But PM 2.5, as an example, is the most studied air quality measure in the world for respiratory health. And so together with AccuWeather, we're bringing together our data, the expertise of AccuWeather, into our hospital, into our data sets, into our research, and soon at the point of care with our children. And really together, we're able to advance our knowledge of the social and environmental exposures for our children that we never had before. So if we want to reimagine what the measurement of air quality exposure looks like in pediatrics, we're taking PM 2.5 level data from AccuWeather. We're bringing that together with other air quality measures like PM10, other sizes, and NO2. And the magic really comes when we bring that really together with our patient records. So in this particular instance, we just took, as a first stab at this, 2,500 kids that got surgery and anesthesia with us. So breathing problems under anesthesia is the #1 safety event for healthy kids undergoing elective surgery. So it's a huge population with a huge opportunity. And for the first time, we were able to actually see this graph, and this was magical at the time we made this. We were able to actually see that a child who lives just south of our children's hospital where that butterfly is located has air quality exposure around 12 or 12.5 mics per meters cubed. The same child, another child that lives in a different part of our city that receives care with us actually receives 30% less exposure to the same measures of air quality year over year. This is groundbreaking to us because this allowed us, with the data from AccuWeather, to be able to provide insight into our individual patient populations, to be able to identify which kids are at biggest risk. We can even start doing some fun things like looking at the higher end exposure kids and the population with the lower quality exposure, and actually comparing the two in large epidemiology studies. And this is really powerful because for the first time, we're unlocking the ability for scientists to actually study at scale air quality exposure in children. You can even start comparing it to WHO regulations and recommendations for air quality exposure. And in this particular instant, this particular population, more than half of our kids live above the recommended limits from WHO. So comparisons like this across the health system have never really been done before. And really, it's the partnership that we're having that enables us to do this. We're able to do the same thing with NO2, which is another measure of air quality that really comes from a different source. So the map looks a little bit different. But if you take a look at our city on the right and relative to the butterfly, which is our children's hospital, there are kids that are exposed on the very low end of less than 10 mics per meters cubed and all the way up to 3 to 4 times the exposure. So we actually never knew until this time in this partnership that kids were exposed to 2, 3, 4x the exposure of air quality in a single hospital. This really enables us to study this differential and see if health outcomes related to this and take the next step and make an intervention around it. and all of our children live above the recommended limit from the WHO. So if you're a child undergoing anesthesia, we know a lot of great things about you. We know the things that cause breathing problems under anesthesia. They include, and these are taught for decades, being really young, having a history of asthma, having exposure of a parent or a caregiver at home that smokes, or having a recent illness. So many times we know these factors. We can do things before you start surgery, before your child starts surgery, to make an intervention to reduce that risk by a lot. Now the question is, what about these other risk factors? What about wildfires? What about exposure to car traffic and major highways? What about factories and where you live? So until now, we weren't able to study those other environmental risk factors. And as a hospital and as an anesthesiologist, we're starting to do that. So over the next couple of years, we'll be studying the impact of what poor air quality looks like on children undergoing anesthesia. It means taking a child who is scheduled for elective surgery, using some location risk factors, bringing in AccuWeather data for air quality measures, and then we place our kids to sleep as we normally would with a mask induction. And then we see how they did under anesthesia. And then we're also going to provide educational tools back to our families in their specific language. We've also taken the next step very recently in applying the same idea to our entire hospital. So in this map here, we actually have the data from AccuWeather for PM 2.5, and actually every single patient less than 21 years of age across our entire health system, which is the largest children's hospital on the West Coast. So on this map, there are actually over 300,000 patients that are represented here. So our hospital, again, is that butterfly in the middle. And actually the 5 different colors there represent the 5 different levels, gradients of air quality exposure. And if you look at the heights of every bar, those aren't skyscrapers. Those are a measure of how many kids live in those areas of our city. So that really highest pillar and the concentration of red just demonstrates that most of our kids actually live in the worst air quality regions of our city that we see. So this is similar to the previous map, but this is actually every child at our hospital. And again, we're able to take a look at every child at our hospital, over 359,000 patients, and start looking at scale, what is the air quality exposure across our entire institution. We can do the same thing with NO2 levels in Southern California. And this geographic swath of land actually covers quite a region. If you look at the butterfly, that's where we're at, and LAX is that airplane over there. And then, of course, the Mickey icons, Disneyland in Anaheim. All the way to the right of that screen, if you take a look carefully, that last icon on the very right, that's Joshua Tree National Park. And then all the way on the left, that icon's a surfer, and that's Malibu. So we have a large area of air quality information from AccuWeather that we have. And we're really thankful for Databricks for being able to provide the medium in which that data is being given to us. And again, you can compare these populations. So across our entire hospital, not just our surgical patients, there's actually a 4, 5, 6x difference in NO2 exposure. That's a huge difference that we never knew about before. So with this partnership and with this data, we're now enabling not just anesthesiologists to do this research, but we're actually unlocking the ability for most of the key departments of our hospital to start studying environmental exposures and pediatric healthcare. It's not just our clinicians, but our health system leaders are now able to actually drive through our system, drive through our city, right? And actually visualize, where do our patients come from? What's their air quality exposure? What are their risks? And this is incredibly powerful for storytelling. It's incredibly powerful for our health system leaders to be able to advocate at a government level what we should do about air quality exposures and regulations around that for pediatric healthcare. So we can revolutionize children's healthcare with weather and climate data. It starts by delivering excellent clinical care and bringing this information to bedside. It starts with education and prevention, being able to find out which patients and families are at highest risk and target our care toward those populations. It starts with research, and of course, it's advocacy at a state and national level. Children's hospitals are incredibly active on the advocacy level and in trying to advocate for better health and environments for children. And with environmental data and patient records, we now have more specific tools for recommendations for our government. So the impact of environment on children's healthcare is real. 88% of children, 88% of global burden of disease from climate change may impact children under 5. That comes from the American Academy of Pediatrics. At our hospital, we saw a 2 to 5x disparity in outdoor air quality exposure across all patients in our hospital. And recently published in our major journal, Anesthesiology, a child's at 1.5x higher risk for having a breathing problem during elective surgery if they're exposed to a wildfire. So what we need is a national network of children's hospitals to study the impact of weather and climate health on pediatric health. I listed a few of the best and top children's hospitals in the country here on this map, and we're building a network at this point to be able to study this and apply the same principles, the same data and expertise partnerships with AccuWeather across the entire country. I want to thank all of these major organizations. These are some of the top organizations in patient safety, in pediatric healthcare and anesthesiology. The Keck School of Medicine, USC, Spatial Science Institute. A big thank you to AccuWeather for their partnership and their commitment to pediatric healthcare, and of course, our Children's Hospital of Los Angeles. So I go back to work tomorrow in the operating room, and myself, along with all of our nurses and physicians across our hospital and across the country, are going to see this. And there's a lot of data that's been put out. Actually, many of these monitors put out thousands of data points per minute. But what I want healthcare to be able to have is the opportunity to understand the social, economic, and environmental influences around our patients. And I think we provided a really great example of how together we can revolutionize children's health. Thank you very much.